All right, let's go ahead and get started. Good afternoon, everyone. Thank you for joining us for our Talent Talk series. I'm very excited to be here today with our talent management, workforce development team. We're going to go through some of their new and exciting programming. This is actually part of a series where there will be several more talent talks coming out in the next few weeks, talking about all of the new programming that's launching that we're going to be actively recruiting for workforce development programming. Today's session specifically covers our patient care technician training program in partnership with Baton Rouge Community College. I'm very excited to have several subject matter experts here today to kind of talk through the program and answer any questions that you may have about joining. Before we get started, I'd love to have our panelists go ahead and introduce themselves. Dr. Meyer, would you like to get started?
Hi, sure. Good afternoon. I'm Tony Meyer. I'm the Executive Director for Workforce Solutions at Baton Rouge Community College, and look forward to visiting with you all today.
Thank you, Dr. Meyer. Claire, you want to go ahead and introduce yourself?
Sure. My name's Claire Knight. I am the program manager for the allied healthcare programs at Baton Rouge Community College, and I work with Dr. Meyer on all of our partnerships and our up and coming classes, and I'm glad to be here.
Mariah, you want to give us an introduction?
Yes, absolutely. Thank you, Morgan. My name is Mariah Bromfield. I am the Workforce Development Specialist at Ochsner Health. Along with my team, I am primarily based out of New Orleans. So I primarily support the team with all things workforce. For this program, I will be project lead, so I will be able to support everyone from start to finish. So I look forward to this exciting new venture that we will be working on.
Yes, thank you. And I think Mariah is really leading the charge for today's Talent Talk, so very happy to have her with us. And then Matt, you want to go ahead and give yourself an introduction?
Sure. Hey, everyone. My name is Matt, and I recruit for the Baton Rouge region. I work in human resources and talent acquisition. So I definitely look forward to having the opportunity to meet with you, speak with you about the program, and then work with you along the way.
Thank you, Matt. And I'll go ahead and introduce myself. My name is Morgan Falgu. I'm one of our talent acquisition managers, mainly working in university relations and then recruitment event management. So very excited to be here with you today and see this panel and kind of go through some questions. So we're going to just jump right in, and we will do a Q&A session at the end, but feel free to drop questions in the chat if you have them as we're discussing different topics. We can also answer in the chat as well. So first, Mariah, I know that the PCT training for workforce development is kind of new. We just started our first cohorts last year. So I just wanted you to share a little bit of the successes of those previous cohorts with the group.
Absolutely, that's a great question. So as you stated, our most recent PCT class was in 2020, which was a hard time, especially for healthcare at that time. But we were able to successfully ensure that we had over 20 participants complete the programming, which was amazing. Our patient care technicians was extremely instrumental in ensuring that we combated the COVID-19 pandemic, as well as they are valuable contributors to our system. So that's why we're here today, so we can bring in more talented individuals.
Excellent. And I know we jumped right in, so I think it might be great if you could share a little bit more about specifically what a patient care tech does in a day, what are their roles and duties, and what does PCT really mean for someone as a job?
Absolutely. So our patient care technicians in our system are mainly our eyes and ears for our nurses and physicians. So they ensure that we provide the basic care for our patients. They provide the compassion to our patients, as well as ensuring that they do those wellness checks from start to finish. So in the end, they are a part of the family, our patient care technicians. So if I can paint a picture for you, I know you often see the nurses and physicians, but typically you would see the patient care technician first. They will take your vital signs, They'll make sure that your beds are clean and you are able to go to the restroom properly. So they are extremely important in our hospital settings.
That's fantastic. Definitely appreciate that, giving us a little bit of insight. And I think as we go through, we're probably going to be referring to the role as both a PCT and patient care tech. So just wanted to make sure everyone knows those terms are interchangeable for us. So Dr. Meyer, I know this is going to be the first PCT cohort with Baton Rouge Community College, but not our first workforce development programming in partnership with your academic institution. Can you share a little bit more about the partnership with Ochsner Health and this new program that we're going to be launching?
Sure. When we look at the partnership between BRCC and Ochsner, we really kind of have the same mission and the same goals where the training of people to get the skills that they need to actually go into the workforce, and whether it is basically first entry into the workforce, or if it's continued skills building within the jobs. We've done a great deal with Ochsner on those aspects. The good thing is that Ochsner, like BRCC, is dedicated to people. So not only the people that they are serving because they are sick or need medical attention, but also the people who work there. I mean, that's one of the best things that we have seen about Ochsner, is that they make a great investment in the people that work for them, in their team. They're constantly building teams that that would not only benefit the hospital, but also the patients that they serve. So that's a great, it's a great, I guess, joining of missions for the two institutions.
Yes, absolutely. And I think we're very excited about this continued collaboration for the Baton Rouge region. I gotta have a follow-up question for you. Can you share a little bit more about why this program would be excellent for someone who's interested in transitioning into the healthcare field and just kind of getting started working in a healthcare capacity?
Well, one thing is that you are needed right now in the medical field. There are so many openings. There's so much that needs to be done. The pandemic really shone a light on how much more we need to do in training for medical positions. So this is the right time to kind of go into that and look at doing something, not only nurturing your career, but nurturing other people as well.
Yes, absolutely. And we definitely appreciate that. And I feel like, just kind of what you're talking about, the people and how important it is, to care for people. I really want to echo that. A career in healthcare, it can be so rewarding. And it's a great time to join. And this is a great program to get started. Also, Dr. Myers, just follow-up questions for you as well. What skills would be ideal for someone entering this program?
So, basic skills, of course, and I may have to defer that to Claire since she is the nursing person. But if you're looking at basically what you need to be successful, you really want to be dedicated, one, to learning. You want to be dedicated to a career, not just a job. So you don't want to just have a job. You want to have a career where you might enter here as a PCT person, but looking at what's going to be your long range future. So Claire, you have any other skills necessary for technical skills necessary for a PCT?
Actually, I'll expand upon what you said. I know it was brought up previously when we've discussed this program, that having compassion and not just looking at this as, and it's important to think of this as a career, but compassion. You have to have that want to be in customer service, that want to make people feel better, not just the patient. You're dealing with your coworkers, you're dealing with family members, you're dealing with children. So that's first and foremost, is you have to enjoy working with people. Second, it is good. You do have to think on your feet a lot. You're going to get a lot of questions, and these people that you will be helping in these situations, whether it be in a hospital or another type of facility, they're having a really bad day. So you really need to be equipped and think on your feet, and you need to have some good communication skills and just a want to be able to do this. I always say, as a nurse myself, you can't just be a pulse filling a spot. These careers in any type of healthcare, because you're dealing with people, that compassion and that thoughtfulness first and foremost, but technical skills, you've got to like getting your hands in there. You've got to like to be able to work with your hands. There's a little computer, but being able to just be on your feet and, hit the ground running when you go to work.
Yes, absolutely. And I feel like it's great to hear from you, Claire, and your experience as a nurse for sure. I think really the biggest thing we've just talked about, how it's so great for someone to get this experience. But Mariah, can you share a little bit more about what you can do with a patient care technician certification, as well as just patient care technician work experience? How can you leverage that as you grow your career?
Absolutely. So the great thing about this opportunity is that not only will you receive a patient care technician certification, but you will also receive a certified nursing assistant certification. So as I stated before, you work very closely with the physicians and nurses. And within our workforce development programming, we offer multiple programs with career opportunities. So you will be able to build a solid rapport with all of them and pretty much feed off of their energy so you can grow within our organization. So this is just a starting point for you. As Dr. Myers and Claire has stated, this is only a starting point for you. You'll be able to utilize your customer service skills as well as your compassion to continue your growth. So also within our organization, we offer our Ochsner Scholars Program, where we will fully fund all of these training programs for you at no cost. And that is extremely important because education can be very costly, but you will be able to get through these programs and be successful within our organization. And that's ultimately what we want from you.
Yes, absolutely. I think that's definitely one of the biggest advantages, the no cost for participants, and really giving them the resources to start a career in healthcare. And as you mentioned, Ochsner Scholars is a great way to grow professionally through the organization. We have so many resources for our employees, just so fantastic. Claire, this next question's for you. Can you talk a little bit more about the training for the specific PCT cohort and what's the education process like?
Okay, not a problem. So we have customized this training with Ochsner, specific and geared to not only giving you everything you need to complete both certifications, right? So patient care technician and for the certified nursing assistant. It is about an 8-week program. The certified nurse aide part of it is going to be, and you have to understand, we follow the Louisiana Department of Health and Hospitals regulations. When we are going through the CNA program, you have to fulfill a minimum amount of hours when completing the certified nurse aide program. And I can't stress this enough, because it is not an Ochsner's requirement. It's not a BRCC requirement. It is literally a Louisiana Department of Health regulation that you fulfill a certain amount of hours in order to complete that program. So it's 2 weeks of classroom and 1 full week of clinicals inside of a nursing home facility, which is great because then you put all your knowledge to work in that clinical facility. But the other part is that BRCC, we have a nursing lab where you will get some simulated experience with our simulated mannequins and hospital beds and resident beds, etc. So you'll get a full experience in our lab before you even go into the clinical environment at the nursing facility. So it's super exciting and hands-on, and it's quick. It's 100 hours. So when I said I stress that, it's just so you can realize what you'll be expected of you for the CNA portion of this program. For the PCT program, very similar. You'll be using and utilizing our BRCC nursing lab that we have specifically for our students and getting your hands-on training. And actually, CNA has its own set of skill set, but for the patient care technician part of it, it's an even more advanced skill set than the CNA. So you will be hands-on most of this program. It is in person, and that is going to be about a 4-week program in itself.
No, thank you. It seems like there's a lot of great resources through Baton Rouge Community College, as well as the Ochsner partnership. Mariah, I just want to confirm, because we already talked about it, but I do think it's important to highlight, to participate in this program, there is no cost to participants, correct?
Correct. This program is fully funded. It's free. So we just want you to be attentive and participate, as Claire stated. It's extremely important to obtain all of the valuable skills that you'll be learning through the CNA portion as well as the PCT portion. And so once you are hired on officially as an Ochsner employee, then you will be able to excel and you will be able to flourish. And that's exactly what we want from you.
That's awesome. I think Caitlin's going to put up a slide with some critical dates here, but Matt, my next question's for you. For everyone joining and listening today that's interested in applying to be a part of this cohort and get this unique training experience through Baton Rouge Community College and Ochsner Health, what would be next steps for them?
So the next step for you, if you are interested in this program, is just to go ahead and apply to the actual requisition that we have posted for the program. And it actually went live as when this meeting started. So if you're interested, you can actually go in and apply right now. All you really need to do is just basically Google Ochsner Careers. It'll take you straight to our careers page. And in the search box, we should have a number. Caitlin, do you have the requisition number? If not, I can just say it.
It's on the next slide.
On the next slide. Okay.
Yeah.
So
and we put it in the chat too. It's in the chat now.
Okay, great. So you have that number there. All you need to do is just visit our careers page and enter that number in. It'll take you straight to it. And then we'll follow up with you shortly to discuss next steps and all that good stuff. Also, we do have an email address if you have specific questions or concerns about the program. It's workforce@ochsner.org. I'm not sure if that's going to be on the slide as well, but that if you do have specific questions, you can reach out to that email and we'll follow up with you as soon as possible with specifics on the program. There we go, yeah, right there. Thanks, Shalita.
Yeah, thank you. And yes, thanks, Shalita, for dropping that email address in the chat. This has all been great information about this training cohort. I think we're all excited to continue to learn more about the great work of workforce development in all of our communities. Here's some of the next steps in terms of how to apply to the position, as well as some critical dates that you may want to look for if you're interested. But we're going to keep this up here for participants to view while we answer questions. So if you have a question, I feel like you could take yourself off mute, or it might be easier if you just put the question in the chat box and then we'll go ahead and answer it. So we're just going to give a few minutes for questions.
And we will certainly share this information as well. So for anyone who is on the line and you are an external candidate, please definitely, Shalita is stating Baton Rouge applicants, residents only. Yes, for this code, for this requisition, this will be for the Baton Rouge area. We are anticipating, I know Morgan may state this as well, but we will also have another talent talk in the near future on July 7th for other regions as well. Okay, so, but this requisition is for the Baton Rouge region.
That's a great question. Any additional questions? Or any comments or thoughts about the training cohort? Okay, if you have any questions, you can absolutely follow up with that workforce email address that Shalita dropped in the chat. Excellent way to get in touch with their team. As Mariah mentioned, we are going to have another PCT talent talk that will be taking place on July 7th. So check our Facebook page for more information about that. And if you're interested in learning more about workforce development programming, we will have several talent talks coming through the end of this month and then into July that you can absolutely tune into. We'd love to have you as a guest. I just want to thank all of our panelists for all of the great information today. And big thanks to the workforce development team for all the incredible work you do. I'm so excited to see this program begin with Baton Rouge Community College and get started. So again, thank you for today, and just check our Facebook page for more information for upcoming talent talks. Thank you, everyone.
Thank you.
Thank you.